Hello and welcome back. This is the last of this workshop series where we are exploring in detail all the skills that we are being assessed and how to best perform in our exam. So here we come to the part that we already had the history, we did the exam, we are formulating now the diagnosis, and we are starting the management plan, which is pretty much to this exam about the education, counseling, and to make the next step or referral. So let's get started. So all the examiner, but for the based on the information that you request, how you talk, and all the physical examination findings that you ask, you will get to a point that you have a list of differentials in mind, and you want to explain them to the examiner in the order of probability. So it's always like the clinical assessment and the diagnosis formulation pretty much starts from when you are introducing yourself. So all the questions that you ask for history and examination findings will lead you to this point. So always keep in mind what is the most probable diagnosis without being close to one thing. It's just being curious. What can these symptoms represent, or is there any urgency? Is there a diagnosis that is life-threatening or serious conditions that cannot be missed? And always ask yourself, the quality of the questions will, of course, get you to better performing. Could the symptoms be because of something else that is going on? So is it just anxiety the patient is having and have multiple symptoms, or is it autoimmune disease or another complex condition that involves many systems? So what else is going on? What's the patient trying to tell me? If the task ask you to give a diagnosis to the patient, explain the condition or explain what you think is going on. So talk in the simple term. But if it's the examiner, so adjust that to have a professional conversation with medical terminology. Most likely you will need to explain the differentials, and it's always good to at least list 3 differentials. So if someone is presenting say for that from dyspnea, you can say, I believe the shortness of breath is probably due to this, but the other possibilities are, and just say, oh, I'm ruling out this because you don't have this in the exam, or I don't believe it's this because you don't have these symptoms. So it's more about, depending on the case and the information that you have gathered, how you explain best what you think you are getting as a diagnosis. You can say always there's more need tests to be done to be clear on confirm a diagnosis, but I know it's not this, I'm ruling out this, and always keep, of course, the order of probability in your mind. If you are sure it's a condition, you know the diagnosis, so the next step will be to explain the patient about the condition, make sure they have a clear understanding in simple terms, and to outline the management. So you can say to a mom, based on the history and examinations, most likely your child has this condition. Have you heard about this? It usually presents like this, it's caused by this. Don't worry, it's not serious, it'll go away, just a few days. We used to be encouraged to do drawings, a diagram, and explain in simple terms in a picture what's happening. You will have pen and paper, but I don't know how easy it is to do in the online format, but you could try. You will get points if you show the examiner that you're trying to put things in a easy drawing for patient to understand. When you explain a condition, talk vaguely. You won't cover the whole thing, but just talk about the prognosis, complications, risk, what can be expected, what could happen, and as well of the management options. And leave always a space for the patient to get back to you. Do you have any questions? Do you know what I'm explaining? Am I clear? Towards the end of the consultation, you want to do the counseling, and there's 5 R's. So you're going to reassure the patient. You are not alone. I'm here to support you. There's a big team. We're looking after you. Refer the patient if they need to be assessed by a specialist, if you need to go to hospital or have a test. Always give reading material. This is some information about the condition. Please read, check with your family. Red flags are very important. I want you to come back here, or I want you to go to the hospital if bleeding doesn't stop, if fever is this, and always make a time for a review. Please visit your GP in 3 days, or if you are the GP, I want you to be back here in a week after the antibiotics. So it's very important that you cover the 5 R's. And with the reassurance, it's about to explaining the patient, is it a serious condition or not? Is it something chronic, or is it just acute? Of course, if an emergency or life-threatening, it's important to reassure and explain that you are doing your best and you will be there to help, and we will do this and that, and just outline the management. And let them feel the emotion and make sure that you know and show the empathy, that you know how they feel. And they're worried, and it's okay to be worried, but there's something that we will do about it. Some scenarios are all about breaking bad news, and there's some great information, spikes it's called, and you want to address all this. So I will quickly outline. You will be able to read them, the notes and all in detail, but it's all about getting in a setting that you have a quiet space where you can comfortably sit with no interruptions, that the patient wants to involve the family, they can be there, that you have tissues, the patient is going to cry. The perception is more about asking the patient, how much do you know what's happening on, what's your understanding, are you aware what's going on, like pretty much, do you expect bad news? And yes, making sure how much the patient knows what's happening and where you are going. Invitation, so check if they are you ready to learn about the results? Would you like me to explain them now? Of course you want to go through it and you will have to explain, but it's more about inviting, like, are you ready to hear this? And knowledge, just deliver the information in chunks, slowly, and make pauses. So as you know, we did a biopsy. Unfortunately, the results are not what we're hoping for. Let's allow the pause. The results are showing this. I'm sorry to tell you that this. And it's just slowly to make sure that the patient digests some of the information. It's going to be a lot of information, so you can take like and make them understand that, you know, it's a lot. You don't need to get all in one go, but it's more about reassuring and making space probably for another consultation. We follow up, invite your family, we can discuss, understanding the emotional reaction and giving time for that. And just focusing, okay, what's happening next? What's the next step? Emotion, empathy, as I say, strategy, and of course, summarize. So don't try to make patient to rush into management decisions or to make something like, yes, after one short consultation to know what's happening in all the plan, but just one step by step, reassuring and showing pretty much all your manners and professional caring. So the end of the consultation, the same, go back and remember who you are and what's your role. If you are the GP, give all the printing material, refer prescriptions or order investigations if you need to. Ask them to come for a review in a few days. Remember the red flags and when they need to seek medical help again. If you need to send them to a specialist or refer them to hospital. Are you in an urban setting or are you in the country, rural setting? How are you going to get the ambulance? Who will drive the patients? All that needs to have in the mind and to show the examiner that you worry about that. If you are at the hospital, start management, you have more resources. So what the patient needs, or the investigations, you have, of course, more resources and you can ask for more things. If you're in a tertiary hospital, admit or living observation, talk to your superiors or who you are going to call to discuss the next steps. And that's it. So thank you so much for listening. This is the concludes this series of workshops. I hope that you have gained some tips. It's more about take on message. There's a lot, but there's some foundations that you cannot miss. And you see, we repeat a lot of stuff, but it's all about being professional, having good communications, and having a strategy and an order how to approach each case. Because it's all about acting, performing like you believe that you are a doctor in Australia. That's the best way to do it. And also focus on your clear English and good time management. So if you like what you see and you want to explore all the resources, as I say, I have all the list of cases by topic and specialty. I have a great compilation of the cases and the scenarios for the last exams, 5-10 years exams, short audio scripts on the most common presenting complaints by subjects, and as well the physical examination scripts, so you know what to cover in each, and just play and play, and by repetition you will get it in your mind, how to address some differentials and how to explain them. And the same management and counseling, just some activities and examples. There's also more workshops about the critical errors that you cannot make for each of these major topics and subjects, and also a summary of the slides that are relevant to the cases and what is being asked. So it's pretty much a quickly review of the whole medicine related to what is important for you to know for the exam. Thank you again for watching. Just check out all the full clinical summaries, and please send this link to someone who may benefit for this information that you have just learned. Take care and best luck with your exam. Bye.